Hello, my name is Helen Allett and I'm from the Liverpool School of Tropical Medicine. This lecture is about an introduction to mentorship. Our learning outcomes are to define mentorship and to describe aims and benefits of mentorship, to outline the qualities and skills required to be a good mentor, and to discuss some of the roles and responsibilities of both the mentor and the mentee. What is mentorship? A mentorship is a developmental relationship in which an individual with more experience in a particular field provides helpful guidance and support to someone with less experience. There are many different ways in which mentorship may be manifest, as you can see from the green diagram. The aims of mentorship would be to give advice and support to a younger or less experienced person in a job. Mentoring is a supportive learning relationship between a caring individual who shares knowledge, experience and wisdom with another individual who needs to be ready and willing to benefit from this exchange in order to enrich their professional journey and improve the care they provide to their patients. It's quite easy sometimes for mentorship to become confused with supervision, but really these two things are very different. Mentorship very much involves the mentor being a person who has gained experience in that field of endeavour. So somebody who's been there and done it and can speak from their own experience to provide support to their mentee. Mentorship may then be less structured at the point of delivery because it will be flexible and depend upon the needs of the mentee. Supervision is rather a way of monitoring and checking how something is being done or how a role is being performed. It can be useful as a means of gauging where input or direction might be needed, but it's much more a checking and calling for accountability for responsibilities that were given, and it's very often a top-down approach from a manager to a subordinate, and as such it becomes very defined. So it's useful to think about some of those key differences, and this is just a picture from a mentorship course that a group worked on together to think about the key differences. So, for example, they thought that supervisors would go and watch and see how things were done, whereas with a mentor, a mentee would work together with their mentor to achieve something. Supervision had a very solid structure, whereas mentorship might have a looser structure, and there might be many different ways of providing mentorship. Supervision was considered to be overseeing, whereas mentorship was much more nurturing. And supervision had an element of measuring, whereas mentorship was more centred on delivering learning to improve practice. So there are quite a few other differences as well. So you can see that the two roles are very different. Mentorship can be quite multi-pronged, so it can contain aspects of coaching, training, advising, giving direction and motivation. So many different aspects to mentorship, and it can be about providing career guidance or clinical guidance and support. So a mentor is generally a person who provides that guidance to a less experienced person. The mentor should then be a role model who shares both their knowledge and advice in order to help the mentee to grow in their professional capacity. And as such, the mentor is then a trusted advisor. Bearing that in mind, we need to think about some of the qualities and skills of a good mentor. So let's pause for a moment and think about some of the qualities that we have recognised in people that we ourselves have viewed as helpful mentors. So a mentor should be somebody who's friendly and respectful and kindly in their manner, but at the same time a real expert in the field who keeps up with the latest evidence, and although supportive, is able to challenge when practice needs to be changed and improved. So effective mentorship requires having an open mind, the ability to listen actively, the ability to ask challenging questions sometimes, and above all, the ability to be honest whilst being tactful and respectful at the same time. The mentor will develop skills as they go through the process of mentorship, and they will improve their skills of self-reflection, leadership, communication, supportive supervision, facilitation, and teaching. So a mentorship scheme will have benefits to the mentees, to the mentors, to the organisation, and then to the clients who in health services are the patients and their families. Thinking of the benefits to the mentor will benefit by developing their coaching and feedback skills, and they will gain satisfaction from the knowledge that they are helping someone to improve in their professional pathway. The mentor will develop and refine their self-reflection skills and their sense of self-awareness, and they will also learn about the issues raised by the mentees, some of which they may not have known so much about before. Mentees have been shown mostly to value the emotional support provided by mentors, having someone else's perspective on the issues that they raise and a chance to discuss their concerns. And this may not be an opportunity that they otherwise have in their day-to-day work. So you can see from this table that there are multiple benefits of mentorship to be gained by the organisation, the mentors and the mentees. However, mentorship is not always easy or straightforward, and you will encounter challenges as you progress in your role as a mentor. Sometimes there will be resistance to change, even when change is required. People are often quite afraid of change and more at ease with doing things the way that they have always done them. So it may be difficult to challenge people to think that there could be a better and a different way of approaching tasks and skills. There may be a lack of an enabling environment. So there may be a lack of regulations that allow mentees to develop skills or endorse them in performing their skills, or there may be a lack of equipment and provisions available to undertake the tasks that the mentee is learning about. There can sometimes be an enduring confusion between mentorship and supervision and assessment, and this can lead to sort of insecurities and uncertainties and a resistance on the part of the mentee. And the mentorship scheme may lack recognition. It could be that mentors have inadequate skills, and then there is insufficient accountability both on the part of the mentor and the mentee. So all these things can be barriers or challenges to effective mentorship that we need to overcome in order to maximise the benefits. Mentorship programs have various structures, and this is just one suggested structure where mentors work with the district health management teams to identify mentees. Mentors are then provided with training, and then they commit to a one-to-one mentorship encounter with mentees, or in some circumstances group mentorship schemes. And they commit to meeting together with the mentees at clearly defined intervals and provide supports perhaps by telephone when meetings are not happening or in between meetings. The mentee on their part will proactively communicate with their mentor on a regular basis and agree to keep a record of their mentorship activities and commit to mentorship encounters and to telephone encounters if face-to-face visits are not possible. Clearly it varies depending upon whether the mentor and the mentee work in the same facility as each other, or whether they work in different facilities as to how often they are able to get together. Looking at the potential scope of a mentorship program, there are many possible areas where mentorship can bring benefit and enhance skills. And this could be, for example, in assessing and recognising danger signs, improving provision of antenatal and postnatal care, and emergency obstetric and newborn care. Mentorship could help with the recognition of when referral is required and maximise the ability to make effective referrals. It can help to improve the quality of care and develop audits of care quality, and look at using data to improve patient care. Mentorship can also hone skills of respectful care and respectful midwifery, and in particular including caring for those with disabilities, and also centre on provision of adolescent-friendly care. So these are just some examples of the potential scope of a mentorship programme, and I'm sure that you can think of many others. So in summary, mentorship is a process through which a supportive relationship is nurtured and develops between the mentor and the mentee or the group of mentees. It's very much tailored to the mentee's developmental needs, and mentorship will challenge practices, fill gaps that are identified, and provide constructive criticism to the mentee. Thank you for listening.